This is my student support system. Keep watching, keep learning.
What is pain? Pain is defined as an unpleasant sensory and emotional experience associated with actual or potential tissue damage. It is the most common reason for seeking health care. Example, backache, headache, toothache, etc. Now we will discuss about types of pain or classification of pain. Pain is classified into three basic categories: acute pain, chronic pain, and cancer related pain. We will discuss now them one by one. Acute pain. Acute pain is of recent onset and commonly associated with a specific and recent injury. Acute pain indicates that damage or injury has just occurred. Acute pain usually decreases as the healing occurs. Acute pain can last from few seconds to even 6 months. Chronic pain. Chronic pain is constant or intermittent pain that persists beyond the expected healing time, that is 6 months, and normally is difficult to associate the pain to the specific cause or injury. Frequently, nurses come across such patients in community-based settings. Now, cancer-related pain. Pain associated with cancer may be of acute or chronic type. Pain in the patient with cancer can be directly associated with the cancer or as a result of cancer treatment like surgery, chemotherapy, or radiation therapy. Harmful effects of pain. Effects of acute pain. Now we will discuss. Unrelieved acute pain can affect our whole body. The pulmonary, cardiovascular, gastrointestinal, endocrinal, immune system are affected by the acute pain. The stress response, that is neuroendocrine. The stress response, neuroendocrine response to stress, occur with severe pain. The widespread endocrine immunology and inflammatory changes that occur with the stress response can have significant negative effects on the body. The stress response occur due to severe pain may increase the risk of physiologic disorders such as myocardial infarction, pulmonary infection, venous thromboembolism, and prolonged paralytic ileus. Patients with severe pain and associated stress may be unable to take sleep, deep breaths, and may experience increased fatigue, decreased mobility, and decreased sleep. Chronic pain. Effects of chronic pain. Chronic pain also affects our body in same manner as acute pain. In addition to that, chronic pain leads to suppression of the immune function. Associated with chronic pain may promote tumor growth. Chronic pain often results in depression and disability. Patients with a number of chronic pain syndromes may report depression, anger, and fatigue. Disabilities may range from an impaired ability to participate in physical activities to an inability to take care of personal needs such as dressing or eating.
My student support system. Keep watching, keep learning.